Hello, today I'm going to show you how to do a TAVR CT workup using the 3Mensio software. First, once you loaded both the chest and the abdomen pelvis portion of the study, I go to the subclavian tab, and then I switch to the abdominal series. And you see that here. I then crop the left side of the chest so that you can expose the aortic arch, and then you can gently rotate here. And you can see now the arch vessel is. You can use the scroll wheel to zoom in to the area of interest. And you just click on one of the arch vessels to highlight the arch vessel anatomy. And you need to, you can see that here you can add vessel. And you can then highlight the carotid. And then you can swing back to the AP view, and you can also highlight the right subclavian artery as well. Once you've done that, you can click confirm selection, zoom in, and now you have your arch anatomy, and you go back and expand this again together. So then I basically do a safe screen. So we'll do AP arch, then you rotate to the aerial view just to see in terms of arch angulation. You can go to the slightly LAO view to see how the sentinel placement will be look like on fluoroscopy. And finally, the arch angulation. You want to make sure the arch is not a Gothic arch, but it's a sharp turn or very generous or any kind of aortic tortuosity. Next, I'm going to click the femoral tab, and then this is going to be looking at the access. So I clicked on the vessel and stand on the abdominal aorta. You can see the entire area is lit up. You can also adjust that window by going up and down, depending on how much you want to show. Once you have that and you're satisfied with the segmentation, then you confirm. You need 3 dots, one in the abdominal aorta. I click the second and third dot at each of the right and left femoral bifurcation to maximize the window I see for analysis for access. Once I click confirm, then you basically want to see that you have a center line for each side. Now you can see that this particular patient, the center line is a little off. So I'm going to drag the dots. You can see that here to make sure the line is centered. And I just basically go down the scroll wheel to each dot to make sure they're within the vessel and at the center. In the case of tortuous anatomy, you might need to actually a little bit more refine in your dot segmentation. You might need to add more dots as you come along. You can see there's a little bit of tortuous band there on the right femoral artery. And then all the way down, you can see that in the middle panel where the bifurcation is. So I do that for the left side now. I click on the left pathway. You can see that here. Going towards the left side, make sure the center line is appropriate. You can add or subtract dots. See, I just add a dot here. And then I bring that into the center. So you can see the vessel is segmented in the center because that will affect your measurements. So, and then I go all the way down to make sure it's still remaining center. And then you can see that here, right at the bifurcation. So there you go. So you click once you have that. There is your stretch vessel view of the femoral artery. I start with the femoral portion because I want to see where the access point is going to be, especially if there's any kind of calcification on the vessel in the medial, anterior, or posterior wall. So I usually go to mid-upper femoral head. This mannequin sign is very useful because it shows you this is anterior. So anterior is not the top of the screen. It's actually on the right side of the screen. You can see that here. That's where the skin is, and that's where the femoral head is. So I clicked on the tool, which you can say ruler ×2, that allows you to measure the long and short axis. And I right-click to click on selecting the right femoral diameter as the label. Then I go to the external iliac. I typically pick the narrowest portion because that's what's most important in terms of access standpoint. And I do the same thing again with the ruler ×2. This is external diameter. And this patient is pretty straightforward access. So I can just go to the common iliac artery rather. And I pick the kind of narrowest portion. Usually I look at the aortal iliac bifurcation because that's tend to be most calcified and narrow. So this is the right common iliac artery label. I do the same thing now on the left side. This is now the patient's skin. You can see that here, that's anterior. So I typically like to mark the vessel in the same perpendicular direction. This is left femoral diameter. This is now the external iliac. And you can see there was a little turn there. And then I just put a measurement at the common iliac. So that's it. So now I do the screenshot. So I save this first. You can see that here. That's kind of the 3D view. And then what I like to do is I go to the fluoro view. So what I can go to this toolbox that can increase the contrast. And this is kind of where I want to stick the femoral artery. I don't want a vascular complication. And I do the same thing for the left side. This is where my ideal stick is. This is very important, especially if high bifurcation, calcified artery. You want to be sure where your stick is matching. And you can just go back at the time of procedure or the fluoro screen to kind of landmark the same area where you're going to stick. And of course, you can always use ultrasound. And I also take a snapshot of these stretch views here of both vessels. And I go to a snake view that kind of shows you the tortuosity of the vessel. And also any kind of calcium wall. This patient does not have any of those, so pretty straightforward femoral access. Now, basically, I'm done. I'm going to go next to the annulus. So the annulus workflow involves first looking at the septal length. This is only an estimate. So I look at this coronal view, and I'm looking for is the base of the non-cusp and where the muscle starts. So I'm looking at this area here, and I zoom in to the field, and then I just draw a ruler and highlight this estimate of the septal length, and then I actually save that screenshot. We have a Dropbox saving that. And then afterwards, I do the automatic segmentation of the annulus. So you can see that here. I'm going to remove this little measurement. So you can see this is a tri-leaflet valve, heavily calcified. So the first thing I do is look at the open red circle. I bisect the left sinus, and then I place a dot on the top upper left panel at the base of the left sinus. I rotate counterclockwise with the open red circle, and I do the same thing for the right sinus at the base of the right sinus with the green dot. And then I rotate again onto the base of the non-coronary sinus with the yellow dot. So now you have an approximation of the aortic annulus. Next step is going to be fine-tuning the annulus segmentation. So I go back and stay in this plane, go to the yellow dot on the top left panel, and then I go up and down to make sure I am at the center of that sinus as it disappears so that it's not asymmetric. And that's also important in terms of from a fluoro angle later on. So I'm going to click on the green dot. This is the right cusp. I do the same thing. You can see I'm pretty close. Go all the way down. And then I do the same thing for the red dot and the left cusp. This is pretty good. Maybe a little bit more counterclockwise. And then we want to make sure also the center line is proper. So you go up to the ascending, you go down to LVOT, it's pretty center. So I'm all set. I'm going to click confirm. So here it is. Here's the annulus segmentation. So I'm going to use the lasso tool to trace out the annulus. Now it's very important to make sure your lasso has smooth edges. So don't put too many dots next to each other. And you double click and it completes the circle, but also it's not too far away. You want to make sure it's inside the contrast. That's where the annulus is. You don't want to be inside like this. You want to be just right. Now, if there's a chunk of calcium right here, you probably want to bisect the area, because if you go inside, you're going to overestimate the perimeter, meaning that the perimeter is larger than you think it is, but the area is going to be smaller than you think it is. If you include the calcium, your area is going to be larger than what you think it is. So you want to be taking the average. So I'm going to label this as the annulus dimension, and then I'm going to save this. I like to put the measurements down below as the annulus in the Dropbox. Then I crop this. You can see that here, tight on both sides. Now I'm going to measure the LVOT. Now I typically do it in a 5mm mark because that's typically where most of the devices land, but you can also go a little bit shallower, like 3 to 4mm. So I do the same thing here. You can see how I do the lasso tool all the way around. See, this is a little bit generous here, so I'm going to go a little bit tighter. And you want to make sure there are no sharp, jagged edges on your anatomy, because that's what the anatomy should be smooth. So now I have this. I'm going to go into the label as LVOT, and then I'm going to take a picture and then label as LVOT. Next, I'm going to go to sinotubular junction. I'm going to actually, at the same time, go to open red circle and bisect the left main because now I can see the left main view in place. I'm going to keep going up until I roughly see the sinotubular junction, which is where the coronary no longer takes off. So I make a right click here. It's called a sinus valsalva height. So that's my default valve sinus valsalva. That's the tallest height. And then this is the level cut point of the left main. So I go to a ruler with a ×2, and then I'm going to go a short and long axis of the sinotubular junction. I'm going to label that as an STJ. Next, I'm going to look at the sinuses, and while I'm at it, I'm going to look at the left main height. You can see whether that's where the left main bifurcates. I right-click here on the bottom left, and then go to left coronary height. There you go. And then you can see that, and I'm going to bisect the sinus height. So 23 here, divided by 2 is 11.5, and that's going to be my usual sinus width calculation. So I use a single ruler going from a commissure to by half of the left sinus, do the same thing of the right sinus, and then do the same thing with the non-sinus. And then you can see that here, I'm going to label it at the left sinus here, label it to the right sinus, and label it as a non-sinus. So here's the sinus valsalva. Now, next thing I want to do is I'm going to pick a valve. So going back to the annulus, you can see this is 539.8 millimeters square. So it'll be perimeter is 83, so it'll be a 34 Evolut FX or a 26 Sapien 3 Ultra valve. So I'm going to put a box here. I'm going to, let's say, pick the Sapien 3 just to look at the calcium distribution in the room. And I'm going to draw a line, yellow line. If you go right, you can see the down to 20 millimeters. So I'll basically 60 millimeters above the annular plane, 4 millimeters below. That's roughly 80-20 on your deployment target of a 26 Sapien 3 Ultra. Now, of course, you can go higher, lower. This is kind of like a more conservative estimate. And then what I do is I go measurement distance. Now I draw the box of 26 millimeter on this side. This is a limitation of this particular interface and this particular panel. You cannot do any diagonal. And I'm doing again, measurement distance. This is a 26 millimeter valve. So voila. So you can see that here, this is what a 26 Sapien 3 Ultra may sit inside this anatomy if we're doing 80-20 deployment. So what you're looking for is risk of coronary obstruction. So let's say there's a big chunk of calcium here. Obviously, it's not going to stay inside the valve, it's going to go outside. And if the sinus is narrow, you might end up risking coronary obstruction right here. Also, at the same time, if the sinus height is short, you're not going to have a lot of room for clearance for coronary obstruction. And this is also a good way to assess redo TAVR. So this root anatomy obviously is generous enough to do another redo TAVR for this patient, but you want to be sure that you don't end up having sinus sequestration or coronary obstruction. So next, I'm going to go to the 1 millimeter above the annulus. And what I'm doing here is that I'm going to right-click on the top left screen. I'm click the ellipse tool. I'm going to draw a circle representing the 26 Ultra valve. So you can right-click it here. And you can say keep circular, and now you can expand and go back and forth in the circle. And I'm going to draw a circle of 26 millimeters. Why? Because I want to see how it fits now in terms of the root rupture risk, in terms of calcium inside the circle. That's going to have to go somewhere. That will have to be going outside of the circle when the valve expands. So we want to make sure there's not a lot of risky anatomy for root injury. So I'm going to click F6 just to save these images. And I'm going to go at a 1 millimeter cut increment just to see how this is very important, I think, in my mind, on bicuspid anatomy, because you want to see how it seals, if there's any risk of the raphe being risk perforating the sinus, if there's any bulky leaflet facing the left main that might risk coronary obstruction. So while I'm talking here, I'm just going to save this all the way to the 7 millimeter, 8 millimeter. I do 10 just because, you know, it covers a lot of anatomy. And after a while, I think the sinuses disappear. So you know kind of already what the anatomy looks like and that's the risk. You can see this particular patient big chunk of non-coronary custard, that's all going to go outside the circle. Same thing here. So if you have a very small sinus, this could risk injury, or the valve may be expanded because it can't push this calcium leaflet out towards the sinuses. So once you're done with the 10mm cut, I go back to the STJ. You can see how that fits. Sometimes if the STJ is small and narrow and you have a valve dimension that's bigger, you might risk dissection, aortic dissections. You want to see how that fits here. So I'm going to say this is a sinus root junction. I go back here to save as sinuses of Valsalva. Next, I'm going to show this here. You can see the left main. Now, sometimes the left sinus is shorter, like in this case. And then you go to the top of the left sinus. If you do right click, that's called measure from basal plane, and you can now look at the left sinus separately from the overall sinus. So I'm going to save the image here of this left main with the box here. You will be able to show all the numbers on this. And then I'm going to click sinus side left LCC just for description. Next, I'm going to go into look at the right coronary height. You can see that's where the right coronary is on the top left panel. I use now the solid green dot to bisect it, and I rotate this. What the solid green dot is showing the right coronary artery on the left side of the screen here, on the bottom right. So I'm going to measure now the right coronary height, probably roughly there. That's the orifice, and then I go back into the top of the sinuses. This looks like where the right sinus will be. I'm going to measure from basal plane. This is the right sinus, and I'm going to save an image here like this. There you go. Now you can also do some other additional work. So let's say I want to label the left main, where it comes off, right? So right here. So you can actually right click and then measurements. And then you can actually pick a marker. You can use the marker too. And then you click it right there. So that's your left main takeoff. You can also do that for the right. Okay, so you can see that here. Right click, measurements, marker, and you can place the dot right there. So that's your right coronary. And then you can see that here, it pretty much represents where it's going to go. So if you want to change a little bit, you can by all means do that. But this actually stays where it's supposed to be. And now you know you can see that this is the left main, this is the right. Okay, so let's look at some other features. So you can see we go back down to the annular plane. And then on the top right screen panel, you go to a calcification. And you can see there's a segmentation of the aorta very nicely. And you can look for calcification. And I typically like to just save an image there. Then you go to a hockey puck. Why is that important? Well, you can see that here. You can tell you the morphology of the aortic valve. You can see how calcified it is. You can even look at, you can see here, the left main and the right orientation. I save another image here. So now let's look at the implant angle. So this is very cool in 3Mensio. So what you do is you have the C-arm 2 on the top left panel. There's an eye. You roll the eye over exactly where the green dot is. And you can zoom in on the panel flow screen. And then you right click to kind of drop off some of the contrast. This is your free cut coplanar view for sapien-free ultra valve deployment. If you want to look at the root angle, I typically use the angle tool here. And then I just draw a line across the dots and then draw a horizontal line. This angle is 48 degrees. And I can save that as well. And what I typically would also do is you can do also the cut overlap view, which essentially just rotate the C-arm over and overlaying the green and the red dot like you did here. And so you can see that, and you can see this is along the S curve, and you can then do the cut overlap view. Now, going back to the free coplanar view, what we're trying to do here on this upper right panel is to identify these leaflet calcium that can serve as fluoroscopic landmark when you position the valve and deploy the valve. So this is very helpful. So I like to see this as well to kind of mentally look at the calcified landmarks on Femoral when I do the case. So essentially, this is the completed workup of a 3Mensio for the TAVR that I've developed over the past 10 years. And if you look at the report now, here's how the report is generated. So you can see this is, I'm going to talk about some name, but you can see that The measurements all here. I do not typically measure ascending aorta unless necessary. You can see the Valsalva, coronary diameters, LVOT, and annulus, STJ. So you can see this here. So I moved this septal link panel all the way to the bottom. That's just my own personal preference. You can just drag. You can drag any of these panels actually, but I like to just put it down there at the very end. And you can see that now, the fluoroscopic view, the calcium landmark, the septal link. So everything what I showed you was there, and you can see that this is the access now. You can see the measurements in the different points of the artery, access point on fluoro, stretch views, and finally the arch view. And when I'm done, I save it to a PDF, and you can then send it to anywhere and to anyone who needs to review this. And at the end, once you're done, you can also save. So when you save or when you close, you have the option to save this, and you can save it to whatever you want, whatever name you want, and you can create as many sessions as you want. So that's it, and hope you find this session very useful. Thank you, and see you next time.